Many times you use strong narcotics to alleviate pain. There's a good side and there's a bad side. Sometimes people get addicted. I'm sure you're very concerned that that could happen to any one of your patients. What do you try to do so you don't get a patient that you're not 100% sure the medicine's being used for the treatment of the pain, but they got a little addicted to a very strong, addicting type of medicine?
You know, there's not a simple answer, and it's fun. I used to do talks around the country, and I used to always kid around. You could tell by how doctors treat patients with pain by looking at the USA Today. In the 70s, we weren't giving enough pain medications. In the 80s and early 90s, we were supposed to give as much pain medications as we could. And then in 2000, it was like we're giving too much. My opinion always has been from the beginning is you have to individualize every patient. I think chronic pain in the next millennium, the physicians who will be the most successful with patients are picking the right intervention when they first see that patient. And you're right, some patients are not good in narcotics. When a patient comes into our clinic who we feel is going to need narcotics or is sent by another physician already on narcotics or has a narcotic problem, is they first need to bring all their records into us. We need to review what's been done. They also will get a psychological evaluation by one of our psychologists, which includes usually an MMPI, the Minnesota Multiphasic Inventory. We always do a urine tox screen, which sounds, wow, we don't trust our patients anymore. But I think urine tox screens will now become the standard of care for most pain management physicians. Urine tox screens serve a lot of purpose for us. 25% of our patients have no idea what they're taking when they come into the clinic, so it helps us to figure out what kind of medications they're on. The other thing is that there are a lot of patients that take narcotics do have addiction problems. There's all kinds of addiction. There's pseudo-addiction. This could take a whole nother talk. But there are ways now of being more careful with patients so they don't get these addiction problems. People have to realize if you put any patient on a narcotic and they're on it for 3 to 6 months, and then that person has to come off a narcotic for any reason, whether they're just getting better or it's not working for them, are going to suffer withdrawal symptoms. It's really common. It doesn't mean a person's addicted to the medication. It's a normal response to the body. And we're running into a lot of that. We get patients who are so nervous about their medications, not because they're having pain anymore, they're so worried that they're going to go through withdrawal symptoms, and they're so busy with work and their jobs, even though their pain problem might have went away, they can't get off the narcotics. You could look now on the internet, there are hundreds of these rehab clinics that are opening up. You can look in the tabloids and you see about promises in California and all these different rehab places where the stars are going. This is becoming a big thing because there's a lot of people that are putting on medications for the right and wrong reason. In our clinic, we're really careful at the beginning. We like to trial everything else we can before we put someone on a narcotic. In some patients, narcotics are the right. Take a rheumatoid arthritic or lupus patient who's tried almost every rheumatology drug, is miserable. That patient's not a good candidate for injections. Might be a good candidate for a long-term narcotic. Now, a young 25-year-old workman comp patient who just had a herniation, who's in a lot of pain, that might not be the right person to put on a narcotic. So I think it's very individualized. You need to bring in a lot of other specialties. I'm very lucky in this clinic because my partner is a physiatrist, a rehab doctor. I have psychologists right on the premises, orthopedic, physical therapist, medical assistant, physician. I have so much backup that we're lucky that we have so many multi-modalities. And some clinics are not as lucky. They might have a...
But team approach is always the best.
Team approach is, to me, the only way to take care of a pain patient.